Do it.
Hi, good afternoon, everybody. Thank you so much for your patience. We apologize because we have our outside, our presenters are coming from the outside. We just wanted to make sure that we had our technology as such. So in this virtual world, we have been tasked with having some patience. So thank you for your patience, but we're going to go ahead and get started. We are excited this afternoon to have the Wellness Committee present to you this special session on information about what to know about the COVID-19 vaccine. So we hope that you will find this presentation very informative. We have two dynamic physicians who are near and dear to our hearts, who's going to present the information. And the style of this presentation is really for them to share some information first, and then we've set it up as such that we're going to be asking them some frequently asked questions. And so with that said, and with that format, we hope that you will hold your questions until we get to the part in the agenda where we will open it up for those that are participants to ask additional questions if you feel like you didn't already hear the answer to a question that you might have. So just some housekeeping rules. If you will, keep yourselves on mute, obviously, and your cameras down. And as I said, when we get to that Q&A part, if you'll be so kind enough to put, if you have an additional questions, just put that in the chat area. We have somebody that's going to be monitoring. That's Paul Hildreth, who is over our emergency preparedness operations. He will be helping Dr. Flannery and I to monitor that site. And I didn't even say, because we started late, good afternoon. I'm Lynn Meadows. I'm Coordinator of Health Services. So again, on behalf of the Wellness Committee, welcome to this session. Since we started late, we're going to go ahead and get right into it. So I am going to actually send it over to Dr. Flannery to introduce our amazing presenters.
Thank you so much, Ms. Meadows. And again, thank you for all of you who are participating on this afternoon's live event. We thought it was very, very important because as we are in the process of beginning initial phases of vaccinations and working with the Fulton County Board of Health, we thought it was very, very important as persons are making decisions about the vaccines. Of course, that is your personal choice. We want to ensure that as you are making your decisions, that in fact you are making it based upon credible and factual information rather than a lot of misinformation. So we thought, what a better way to do this. There isn't a better way to do this other than to get active practitioners who can give us the kind of talk about the process a little bit. And the hopes, of course, are to ensure that you are knowledgeable. Many of us have taken the initial vaccine with respect to the state's overall rollout plan. And we wanted to just kind of put you in a position that you're able to make an informed decision. So with that in mind, thank you to our two medical professionals who are here today. And first of all, I'd like to make a really brief introduction of both of them. And we'll start with Dr. David Holland, of course, who is the Chief Clinical Officer of the Fulton County Board of Health. We have been working with him for a number of years, and more specifically during this last pandemic, as we have been in close partnership with the Fulton County Board of Health. Dr. Holland comes with many years of experience in the medical field. He is a true professional, and anytime we have an issue that we need professional opinions or professional expertise, he is working with us, the Board of Health, and our executive leadership team. Our other presenter this afternoon is Dr. Jeroson Williams, who I have known for many years. He's a native of Southwest Atlanta, received his undergraduate from Morehouse in biology and his medical degree from Wayne State University. Interesting thing, Dr. Williams right now is a general surgeon resident at Emory University. One of the things he has done, which really I thought he'd be a great addition to this, is he served as community liaison to bridge the gap between health literacy and decrease the health-related disparities. So from the onset of the pandemic, he has made his mission to engage people in open forums, such as what we're doing today, to dispel any untruths around the COVID-19 virus and its management. So with that in mind, we are pretty much going to start, and I will just ask the question, and we'll just kind of go back and forth. And Lynn, if I may, I'll pose the first question to Dr. Holland. And Dr. Holland, if you would, please provide a brief overview of the status of COVID-19 in Georgia and Fulton County. I know we've been hearing different things on television. Give us the real deal. What's going on in Fulton County and in the state? What are you seeing from your perspective?
Yeah, the case rates are skyrocketing as are hospitalizations, and deaths are also increasing. We've gotten a lot better about treating COVID, so there are fewer deaths now. The actual mortality rate is lower now than it was at the beginning of the pandemic, but that's at the cost of long hospitalizations, and even people who survive still end up with some long-term problems for it. So it's always better to not get it. But it is, we're reaching new record numbers in cases every single day.
So
Okay.
Thank you, Dr. Holland, for that. We appreciate that. And so what we're going to do now is ask Dr. Williams if he would just talk a little bit about the actual vaccine. Talk a little bit about how it's administered, how many doses, and the two most current vaccines that are currently now out there. So Dr. Williams?
Yes, ma'am. So it's a pleasure to be on the call. As a Atlanta native and a product of Fulton County School Systems, definitely honorable opportunity to kind of be able to talk to folks about something that's near and dear to my heart. And just to contextualize, all the things that I say here today, as a general surgery resident, and we spend quite a significant amount of time in the ICUs, and I'm currently spending a bunch of time in the Grady ICU now, so I'll be in the Grady ICU now for the rest of this month, and then the Emory ICUs next month. And I can tell you from firsthand experience that mentally, emotionally, we're overwhelmed in these ICUs. All beds are full. We're short-staffed. We're having these very tough and difficult conversations with family members on a daily basis about the potential impending doom of their loved ones or the prolonged hospitalization of their loved ones, which they don't get to see for weeks on end. And so we've never really faced something like this as a healthcare system. And it's very important that we continue to have open forums like this to dispel any myths and untruths about the vaccine, which ultimately will lead us to herd immunity and ultimately lead to the end of this pandemic. But to touch on your question, kind of concerning what this vaccine looks like or what the vaccines look like and the doses, so I can qualify that as well. So I've received both doses of the Pfizer vaccine. It's two doses, and so with Pfizer, it's supposed to be 21 days between the initial dose, that index dose, and your second dose, and then for the folks that received the Moderna, it's typically 28 days between that first dose and your second dose. And I guess some of the many myths I've heard about folks not wanting to receive this vaccine is the speed of the rollout. And folks were concerned that, it seemed like just 6 months ago, we had no idea about what this novel coronavirus was. And now that we have multiple vaccines and that are reporting pretty high levels of efficacy. And some people just don't trust and don't believe that. And I'll go on to say that, these are mRNA vaccines, which is just this fancy word of saying that it can teach your cells how to make certain proteins to fight against the vaccine. And this technology has been around for decades on end. And so, specifically Pfizer and Moderna, when heard about, what was happening in Wuhan, China back in January, these companies, this is kind of essentially what they do. They jumped at the opportunity to kind of be the first to roll out this vaccine. And so, these folks were working on it from January 10th, when the Chinese kind of posted the sequenced genetic code of the virus, and by February 24th, they were ready for clinical trials. They're ready for clinical trials. At least Moderna was ready for clinical trials. And so this is kind of the speed in which this thing was rolled out, and through their investigation and through some of the literature that they've published, we're able to see how effective this thing was. And so for Pfizer specifically, you're talking about over 43,000 folks that were a part of this trial, all over the age of 16. And they got the vaccine 21 days apart, as I previously stated, and then they followed these folks for 2 months to determine whether or not they developed COVID or COVID-like symptoms. And 95% of those folks who got the vaccine did not develop COVID or did not have COVID-like symptoms. And so that's pretty significant. That's pretty profound when you put in context of efficacy and how this and how this vaccine works. Especially when you compare the side effects that they observed in the study, which they've admitted that the vaccine is reactogenic, which means your body, especially younger folks with a more robust immune system, can have the potential to have more robust side effects. So you may have some fevers, you may have some chills, you may have some myalgia and body ache, but those symptoms go away relatively quickly, right? And so for folks who are higher risk, there's no way that you can compare the risk of getting COVID, the effects of getting COVID, to the experiences that you have with 1 or 2 doses of the vaccine.
Great. So thank you for that great answer. So I have another question now. I'm going to ask this question to Dr. Holland. So just to continue what Dr. Williams was talking about, can you tell us more in depth about how safe is the vaccine and how do we know?
Well, so I just want to add, you did a great job of explaining, how this vaccine was developed. But I'd add that, they were working on these vaccines actually before COVID was even a thing. There were, if anybody remembers earlier, many years ago, we had SARS and we had M.H.S, the severe acute respiratory syndrome and the Middle East respiratory syndrome, which, were we were afraid they were going to become pandemics, but they kind of petered out. But they were, they're still around, and there are people working on vaccines for them, and they're just not a lot of. They weren't considered very important, so not a lot of money went into them. But people were working on vaccines for these diseases, and it turns out they're both very, very similar to COVID. So the information that we have on this vaccine goes back a lot longer than just the beginning of last year. It's actually several years. But there were multiple trials done about these vaccines, and in them, there were some side effects, mostly people getting fevers and things, as Dr. Williams explained, which is basically your body responding to the vaccine, proving that it works. And in the trial, nobody had anything, really severe happen. It was more common in the people that just got the sugar pill, or not sugar pill, but the empty shot. And since then, we've had, as they have rolled it out, they've had a handful of people that have developed some allergic reactions to the vaccine. Whenever you roll out any vaccine or any drug or anything, there's always going to be a handful of people that have an allergic reaction to it. But these are almost all in people who have had previous severe allergic reactions to other things. These are people that have bee stings and have to carry around an EpiPen, that kind of thing. And even among those people, it's still very, very rare. So, it was studied in 43,000 people each, and then, we've rolled it out to hundreds of thousands worldwide, and we're still seeing the same thing, which is, they tend to be very safe, and they're very, very effective.
Thank you so much. Next question I will pose to you, Dr. Williams. I know that even as early as today, I heard about another vaccine that is being considered for emergency authorization. But could you explain to those who may not have a clear understanding, number one, how is this vaccine administered in comparison to other vaccines such as flu and so on and so forth? And you talked about, you may have alluded to the two brands that are out right now. What are the differences in those two brands? Someone said before, well, you know, when I go, I want the Moderna. When I go, I want the Pfizer, this versus that. Can you just talk about that briefly?
Yeah, definitely. I think yeah, there's a ton of different vaccines like rolling out across the world for the same virus, and they take different approaches. You know, it just turns out that the Moderna and Pfizer are both mRNA vaccines, but there are, you know, weakened virus vaccines very similar to like the measles vaccine, where they're putting in just weakened versions of the virus, and you know, so I mean, it's you know, multiple countries had this massive effort to try to figure out ways to quell this pandemic. And so you're going to see over the coming months a number of different vaccines from a number of different places. Now, whether they get cleared to be administered to folks in the United States or whatever else, and you know, that's still to be debated, especially with the efficacy that we see with Pfizer and Moderna. But comparing those two, and so you know, comparing those two, they looked at in their studies, they looked at overlapping populations, but still different populations. Moderna was looking at folks over the age of 18. And then Pfizer is over the age of 16, and I think Moderna now is going back looking at some research between folks 12 to 17. And we look at the efficacy of both vaccines. I mean, they're essentially the same. Pfizer is 95%, Moderna is like 94.1 or some obscure number. And then there was some data that suggested that maybe Moderna was less effective in folks over 65, but there was some maybe sample size error because of the number of folks that they had over the age of 65 wasn't as high as there was in the Pfizer, and so maybe that was some room for it to be some bias there. But both vaccines have been tested amongst multiple different ethnic groups, white, black, and otherwise, and they've all been shown to be effective amongst that. They both require 2 shots. And I told you before, 28 days between the Moderna shot, 21 days between the Pfizer shot, and these are still kind of arbitrary. You know, there's some folks that suggest that such strict adherence to the timing between the doses isn't as important. But from a systems standpoint, I think that's where you kind of find your biggest difference in Moderna and Pfizer. And so I try to dissuade folks from having a bias towards one versus the other, because one versus the other may not be available to them. So as far as shipping, the Moderna vaccine, it can be stored at -4 degrees Fahrenheit, which is just a typical freezer. You can keep it in doctor's offices. It's a lot more convenient than Pfizer, which has to be stored at a much colder, ultra cold fridge, which from a system standpoint just wouldn't make as much sense. And so I tell folks to prepare themselves, even though I took Pfizer and I advocate for the vaccine. I don't have any experience from taking the Moderna vaccine, that there should not be a bias. The research shows the same thing, the same level of efficacy, and that if you're given the opportunity to take either one, then I would do so.
So thank you for that, Dr. Williams. So one burning question, and this is a frequently asked question, is about side effects. So once I've had, and Dr. Holland, if you'll speak to once you've had the vaccine, what are some side effects that can be expected after the first dose? And are those the same side effects that you can experience or you will experience after the second dose? So can you talk a little bit about side effects and if there are any contraindications?
Sure. So the side effects after the second dose are basically the same as after the first dose, except that after the second dose, it's more common for people to have more severe, they tend to be just a little bit worse after the second dose than after the first, because you're kind of getting a booster. All the side effects tend to be, things that are indicating that your immune system is responding to the virus. And the most common thing is pain at the site of the injection. I had that. It was very mild. I was still able to lift weights the next day. So, but it can be a little bit worse for some people. Fever, muscle aches, and fatigue tend to also be somewhat common as side effects. And these peak after a day or two. There are some people that actually have like swollen lymph nodes and things like that, and pain and swelling later, after 5 or 6 days. That's very uncommon, but it does happen. So don't be alarmed if it does.
Thank you very much, Dr. Holland. I'd like to pose this question to Dr. Williams. I have never gotten over my fear and dislike of needles. It just stuck with me from the time I was a kid, and sometimes it's a necessary evil. But now that I have, I'm just hypothetically, now that a person has received the vaccine, what can they expect? How long does this last? Is this something I have to go back and do every year? Or is it a one-stop pop? And after the entire vaccine cycle has been completed, am I clear now? Can I really get rid of the old dreaded face mask? Can I go out to the community block party? I mean, talk us through that.
That's a very good question. It's a great question. And you better not ever see me in the office, because I have something worse than needles there for you as a surgeon. We have a lot sharper than those. But we talk about how long the antibodies last for this thing, or how long your immunity lasts for this thing. It's still very new, very novel. I think a lot of data has shown that 8 months out from the vaccine, folks still have antibodies. And even without, serum antibodies, and these antibodies are essentially the proteins that are fighting off the virus and keep you from getting infected from the virus. And so even without those being in your bloodstream, your body still has the knowledge of how to produce those antibodies. And so, as of now, we can't really say with any sureness how long you're going to be protected. And is there a potential, a year down the line, you may need a booster, similar to folks needing a booster shot for tetanus or whatever else, to just make sure your body still remembers, how to make these antibodies and such. That's a possibility. But as of now, it seems like folks have a really good and strong and prolonged immunity against this virus from this thing. Now, this is the thing, though. This is the other kicker, and they talked about it in all the papers, is even though, you're protected from having a severe reaction to COVID, and you're protected from getting sick from COVID, it does not mean you can't still be a carrier of the virus, and you can't still spread the virus. And so just because you have the vaccine, and because I've gotten both doses of the vaccine, and I'm a couple of weeks out, and so theoretically I should be immune, it doesn't mean that I still can't transmit virus to folks. And so it's still very important that you wear masks, that you practice social distancing, and that you do hand washing and all the necessary precautions to prevent from spreading to folks who haven't gotten the vaccine, and those folks that are higher risk. One of the other things is, there's data showing that people who have gotten COVID in the past do have a level of immunity for a period of time. Now, it's not as prolonged as it would be with the actual vaccine, but you do still have a period of immunity, and we don't know if those folks could still be carriers of COVID as well, and still be spreading COVID as well. And so that data is yet to be unseen as of now. But all our recommendations will be: you get vaccinated, you're protected, but make sure you protect other folks, and make sure you do your due diligence to protect other folks. And then that's how we kind of beat this thing.
Great. That is an excellent question. That was an excellent question and an excellent response. So Dr. Holland, to piggyback a little bit on what Dr. Williams was talking about hypothetically, after you get the vaccination, both the first dose and second dose, what is it from a public health standpoint should people continue to do? Because I really want, I think our staff to hear that clearly about what can you expect once you've been vaccinated.
Yeah. So I'll tell you, what we know for sure, as Dr. Williams saying, is we know for sure that the vaccines prevent symptomatic disease. They are really, really good at preventing severe disease. So, like, even the people that got sick in the trials, like, that got the vaccine, it kept them out of the hospital and kept them from, being on a ventilator and things like that. So that's very important. What we don't know is whether it really prevents asymptomatic disease. There is some data that suggests that it probably does, but we don't know that 100% sure yet. So what we're recommending is, after you get the vaccine, when you're out in public, still wear your mask, because in case it is possible that some people might still end up with COVID, but have very mild case of it, not notice, and give it to other people. So that's why we're recommending that you still continue to follow the precautions, masking and social distancing.
Great. Thank you for reiterating those things. So one last question before we open it up to taking some of the questions from our participants. Talk a little bit about what people can also expect after they take the vaccine with regards to the CDC's vaccination health check, where you go in and you have been vaccinated. You talk about or you share what symptoms that you might be having and why that's important to make sure that if you're vaccinated, you sign up for that program.
So you're talking about the VSafe program, which is something run by the CDC to track vaccine side effects.
Yes, sir.
When you get vaccinated, you should be given information on that. It's voluntary, and you sign up on your phone, and they'll send you a text message once a day for a week, and then they'll remind you when you're due for your next shot. And basically, they just ask you like 2 or 3 very simple questions about any symptoms you might be having, like fever or pain at the injection site or other things, and how bad they are. And you just answer those questions, and it goes into a database. And it helps the CDC know how common it is to have side effects. Because they're trying to collect data and information on this, and it helps them make better decisions in the future.
So I have one final question that I want to pose to Dr. Williams. And Dr. Williams, I will say recently I received the first dose of the vaccine, and I just kind of shared it with a couple of people. And I just was under the impression, with this pandemic being so profound, that everyone given the opportunity would take advantage of it. But it kind of caught me by surprise. There are many of my close friends, and quite frankly, some of my family members who, surprisingly to me, are somewhat hesitant about the vaccine. And as I look at the numbers again, they are so concerning. What would you say to the person who may have that degree of hesitancy? How would someone convince them? Again, what would your parting statement be as a physician regarding the vaccine? What could you tell them particularly people from ethnic groups that may have systems of distrust regarding the vaccine?
Right. I think the first thing is it's very important to acknowledge, the historic basis that folks have a distrust for medical systems and for medical testing and things that haven't been necessarily proven through time, and so it's understandable. I see it all the time in the hospital. there's just a general distrust sometimes, and you have to earn that trust. And that's the trust, and that's contingent upon every medical professional to earn that trust from their patients because it's been lost in the past. I can tell you that 1 in 800 Black folks are dying from COVID. And 1 in 1,100 Latino folks are dying from COVID. In comparison to 1 in 1,300 white folks dying from COVID. So this is something that's affecting the Black community, Black and Brown community at a significantly higher rate. And they're at significantly higher risk of contracting coronavirus and having worse outcomes. And so it's with that understanding that I would urge folks to kind of go forward with getting this vaccine, and kind of speak on my experience, speak on the data as best I can. But I think acknowledging folks' distrust, acknowledging the fact that just acknowledging folks' distrust, acknowledging their hesitancy about things, but trying to get them to understand that this pandemic does not end if we don't take the necessary steps and precautions. And those necessary steps and precautions are 100% getting this vaccine.
Thank you so much. So I think at this particular time, Ms. Meadows and Mr. Hildreth will pose a couple of questions that are being posted in our chat box. Lynn?
That's correct. So Paul, can you tell us, go ahead and queue up one of the questions that are in the chat box, please?
Sure thing. First question. Is the vaccine safe for someone who's trying to get pregnant? Who is pregnant?
So Dr. Williams, if you'll address that question.
Yes, I think someone needs to put their phone on mute. It's really bad echo.
Yes, everyone check their phones. Make sure it is on mute and your computers. We're getting an echo.
So concerning whether the vaccine is safe for pregnant folks, the research and the data is not there yet. Maybe Dr. Holland can speak to it a little bit better than I can. But immuno.
I'm sorry, Dr. Williams. I think we had some technical difficulties. Can you provide your response again?
Okay. So like I was saying, certain populations, immunocompromised populations, which are folks who either undergone chemotherapy or cancer, and these people whose immune systems just aren't as robust as ours are. Pregnant folks, and kids, there's still folks that have to be collected on, and it's just yet to be unseen. So we don't know. We don't know if it's safe yet. Maybe Dr. Holland can speak more to that. That's my understanding based on the research we have thus far.
Dr. Holland, do you have anything to add to that?
Yeah, so the CDC put out recommendations for pregnant women, and the recommendation is that pregnant women can get it after consultation with their obstetrician. The issue is, as Dr. Williams said, we don't really know, about safety, but we do know that actually getting COVID when you're pregnant is very bad and very severe complications of getting COVID if you get when you're pregnant. So they want to offer pregnant women the opportunity to be pregnant, to be protected, but they are kind of hedging and saying, talk to your obstetrician. The only absolute contraindication to the vaccine is either being under the minimum age of the vaccine, and the other is having a severe allergic reaction to any component of the vaccine, which really the only way you would know that is if you've had the first dose of the vaccine, because there's not a lot of stuff in vaccines that are in other medications or vaccines. So.
Thank you both, Dr. Williams and Dr. Holland, for that answer. Paul, will you go ahead and give us the next question?
Sure thing. Can you still get the vaccine if you have COVID symptoms?
Still a very bad echo.
So let me pause 1 second and just ask everybody again if they'll put their phone on mute and or their computer. This is really great information. We certainly want everyone to hear all of the responses. So Paul, would you ask that question again?
Yes. I think we're just having a technological issue here, but let me try the question one more time. Can you still get the vaccine if you have COVID symptoms?
No, they actually recommend that you wait until till you're better. Because really, it's not dangerous. Just don't want to confuse like COVID symptoms for a vaccine reaction.
And something I've heard Dr. Williams and Dr. Holland is another frequently asked questions piggybacking on about if you have COVID symptoms and should you still get the vaccine at that time. Also, can you address if you've recently, we all know it's winter time and people are still getting flu vaccines. So can you address if you've had another vaccine, say whether it's flu or the pneumonia vaccine, if you can still take the COVID if you've just recently had one of those vaccinations?
Yeah, what the CDC is saying is to wait 2 weeks after you get another vaccine before getting the COVID vaccine. There's no real data on that. It's not dangerous to get them too close together. They're just concerned that maybe the COVID vaccine won't work quite as well if you've recently had another vaccine. So they're recommending waiting 2 weeks.
Thank you for that. And Paul, the next question.
After the second dose, how long before you can consider yourself protected from getting COVID-19?
That's a great question. Dr. Williams.
Yes, ma'am. So now, per the studies, and we're relying really heavily on the data that we have because of everything else is really just anecdotal. They followed these folks for 2 months after, and these folks didn't develop any symptoms of COVID in the 2 months after. And so typically they're saying at least a couple of weeks after that second dose, you should at that point have a level of immunity that prevents you from getting the virus. After your first dose, you have up to 50% immunity, and then that second dose kind of tips you over the scale and gives you over the 95% that you're looking for.
Great. Thank you for that. Paul, next question.
Can you still become infected during your 21 or 28 day wait time?
You can. So that's so you're less likely to be infected still, right? So you have that 50%, 54%, I think is one of the numbers that's out there. You still have that level of immunity. And so you're less likely to get infected, but there's still the possibility and risk of you getting infected. So it's still very important that during that wait time that you're wearing a mask, that you're social distancing, and that you're doing all the things that the CDC recommends folks do not to get coronavirus.
Excellent. Thank you. Paul, next question.
Is this going to be like the flu in that basically it's impossible to get rid of it? Will we be doing this all the time?
Dr. Holland, your thoughts about that?
I don't, I think it depends. It depends, I think, mostly on the duration of immunity for that we get from the vaccine and from prior infections. You know, with the flu, your immunity wanes, and we also have like different strains of influenza moving through every year. So even if you've had the flu shot or the flu or whatever, you know, your immunity next year there's not enough immunity left over in the community the next year to keep it from circulating again. However, you know, there are some diseases like hepatitis B or smallpox, which we don't have anymore, or measles or some other things where the immunity is very long lasting. And if we can just get enough people vaccinated, we can get rid of it. So it depends largely on that. And as Dr. Williams mentioned earlier, we don't really know. Reinfections have occurred, but seem to be very rare. And as far as we can tell, the immunity from the vaccine, which is generally a little bit more robust than in natural infection, seems to last. So we're hopeful that it will continue and last long enough for us to be able to eradicate it, but we'll just have to see on that.
So thank you for that. That brings up something else that you were talking about, like the flu strand. There's multiple different flu strands every year, and of course the flu vaccine changes every year. So that leads me to pose a question while we're on that topic, Dr. Williams. What about these new variants of COVID that we're hearing about? Can you speak to that?
Sure. So I'm sure most folks kind of heard about the different strains of COVID, and have been reported to be a little bit more effective than the strain that we had currently. I think they call it the UK strain. The vaccine targets, you know, the proteins on the outer layer of the virus, and so, you know, regardless of this specific strain type, you're still protected if you get the vaccine from the variations as it stands. And kind of like Dr. Holland said before, you know, you can't get viral mutations, and you know, if you kind of compare it to the flu, you know, you don't have enough immunity to kind of protect you from certain viral mutations. But as it stands, this new strain, the UK strain, and more infective strains, if you've had COVID before and you have a level of immunity to it, there's a good chance you're going to have a level of immunity to this new strain because it's the same protein, same outer coating proteins, and the same thing with the vaccine. They're still targeting the same outer coating of that virus that prevents you from getting sick.
Thank you so much for that response. Paul, the next question.
So I have a question. Where can I find data on allergic reactions, or what other allergies make an allergic reaction more likely?
So Dr. Holland, you want to speak to that?
Yeah, so the CDC just published an MMWR, Morbidity and Mortality Weekly Report on anaphylactic reactions associated with the Pfizer vaccine. There were like 20 of them that they counted out of, I don't know, hundreds of thousands of doses, so not a lot. And 17 of those, I believe, don't quote me on the data exactly, but it's about 20, and then 17 of them were in people that had severe, you know, prior severe allergic reactions to other things. But that's it. The CDC published that. It's all free on the CDC website. You can look up CDC MMWR and kind of go there.
Awesome. Thank you for that.
I think that's an important part. That's an important point, Dr. Holland. A source of good information and to avoid some of the misinformation out there that folks may see on, you know, Instagram, Facebook, otherwise, is the CDC's CDC.org, the site. You know, they have all the data there. They have graphics there that kind of explain some of the things that you may have questions about. You know, they have the disparities in health data there. You know, they have data about the rollout, some rollout plans regarding, you know, what folks should get the vaccine first and who you should contact and all these things. And so that's a very good resource for people to use is CDC.org.
Thank you so much for that, Dr. Williams, because we definitely wanted, before we ended this session, to talk about what are some resources and where staff can go and find out good, credible information. So Paul, I think we have a time for a couple of more questions because what we'd like to do is end it on having Dr. Williams and Dr. Holland share their final thoughts, but I think we have enough time for a couple of more questions. So Paul, is there another question?
Yeah, it's kind of a follow-up on that previous question. We've seen several questions today in the Q&A about very specific things that I guess people are concerned about. So maybe it's their prior medical history, or maybe some allergic reactions to certain specific things. So what would you recommend for them to do to get answers directly about their questions or concerns?
So, I think they should talk to their doctor, or, if they're coming in for a vaccine and have a specific question, we have nurses and doctors on site that are experts in this, and, at the Fulton County sites, and I know Grady does too at their sites, so they can ask them. But I think the thing that I would say in general is that the reactions that people that we're most worried about are things that have put you in the hospital, or that have required you to use an EpiPen, like your throat closing up and you can't breathe and stuff like that. So a rash or hives, or I'm allergic to, this drug or whatever, it makes me nauseous. None of that is what's worrisome. And there are no known medical conditions that are absolute contraindications for it. We talked about pregnancy, people with, that are on, certain immunosuppressives or chemotherapy and things like that. Those are not contraindications. They may possibly make the vaccine a little bit less effective. We don't know. But, the vaccine is basically recommended for virtually everyone, except for children, and people that, have had a severe allergic reaction to the first dose. And again, that's been very, very rare. Like, we haven't seen any of it yet. So here, like at Fulton County. So
thank you so much.
That's where I would go.
Well, gentlemen, first of all, let me say this, and there are some additional questions, and our team is going to capture the questions, and we will assist in getting responses to those. We want to be very, very respectful to the time of our presenters. Again, gentlemen, thank you so much for your time. We know that you're very busy considering everything that's going on. It says a lot about your commitment to the community by taking time out for this. So on behalf of Fulton County Schools, we want to say thank you. And I would ask in 2 minutes or less from each of you, and we'll start with you, Dr. Williams. Would you give us any departing thoughts, as I said, any type of inspiration to assist those who may be apprehensive? I'm sure some of us somewhere have some very close coworkers who prior to today may have had reservations about this. What would the departing thoughts be regarding that? Ultimately, we understand people are going to make their decisions, but if this were a family member or a close friend of yours, what would your thoughts be to them in 2 minutes or less?
Right. And thank you for that, Dr. Emory. I've had this conversation with most of my friends, definitely as many family members as possible, and my parents pretty often. And my dad, to this day, very type A type guy, wants to know all the details and all the facts. And the fact that, we're still learning so much about this virus, learning so much about this vaccine, doesn't necessarily sit well with him. And when I can't give him all the answers that he may necessarily want, it doesn't necessarily sit well with him. But he understands, because I've made it very clear that the way that we end this pandemic, and the way that we get herd immunity, and the way that we protect ourselves and the way that we protect others is by getting this vaccine. And that the risk of getting the vaccine is head and shoulders significantly lower than the risk of contracting coronavirus and ending up really ill with lasting effects from COVID. So, I urge those folks who are still apprehensive, reach out your PCPs, to your physicians, to your PAs, to folks who can kind of talk more in depth with you, and take more time to talk more in depth with you about the vaccine, about the virus, about why or why not you should be getting this vaccine. And I would say go from there, but not to sensationalize folks' death, or not to sensationalize the efforts of folks, our healthcare workers on the front line, but especially the people on this call. You guys are the front line. When school resumes and when kids are back in school, you guys are the front line. You guys are responsible for educating our kids going forward. And we need you healthy, and we need you alive, and we need you here. And what we can say is last week and yesterday and this month, I mean, we're getting deadlier and deadlier. This virus is becoming deadlier and deadlier. Even though the number of folks getting the virus, mortality of course is going down, but the number of folks dying each day is still increasing, and our hospitals are at capacity. The worst scenario you could be in is to be really sick with this virus and need to come into the hospital right now, because we just don't have the resources. We don't have the resources, and so it is at my behest that I encourage everyone to get this vaccine once it becomes available to you, to encourage your loved ones and family members to get the vaccine when it becomes available to them. And, we'd be able to kind of stop this pandemic in its tracks.
Thank you so much, sir. And Dr. Holland, did Dr. Williams miss anything? I posed the same question to you, sir.
I don't think he missed anything. The only thing I would add is that I'm a specialist in infectious diseases, and my colleagues and I are the people that are experts on viruses and immunology and vaccines. And we're all at Emory, and we're doing all this research. I have colleagues that are that have done the research on some of these vaccines, or continuing to do research on these vaccines, and on COVID, and on viruses like COVID. And I will tell you this: every single one of us has gotten the vaccine. Every single one of us wanted to be first in line for the vaccine, but couldn't be, because we know, we trust it. And I don't know if that means anything to anybody, but if the experts want the vaccine, it might make you think that maybe there's a reason why, because none of us want COVID at all, and we trust this. So if that means anything at all, then I would then please pay attention to that. And I'll tell you, when the Fulton County Board of Health got their first doses, the first person to get their vaccine was the health director, Dr. Paxton, and the second person to get a dose was me. So, that's how badly I wanted it. So I hope y'all will all come out and get it.
So thank you so much, Dr. Holland. Thank you so much, Dr. Williams. I know that both of you all are extremely busy, but we just sincerely, on behalf of Fulton County School System, sincerely appreciate you taking time out of your busy schedules to help bring some information, some vital information at such a time as this, to share with all of our staff. I also like to thank the Wellness Committee, Daphne Reed and Judy Claybrook, for helping us from the behind the scenes to bring this presentation to our staff. I just want to end with this. I've heard three real key themes from both our experts, from Dr. Holland and from Dr. Williams, and what those three key points I've heard, and there were three words actually. The vaccine is safe, tested, and effective. So I'll leave you all with that. Thank you to all of our participants. We really appreciate you tuning in. If your colleagues were not able to join us for this live session, please let them know that we are recording the session and we will make it available to everyone. So thank you so much for spending time with us. Sorry for the little technical glitches, but we appreciate your attendance this afternoon. Have a good afternoon, everybody.
Thank you for the invite.
Thank you so much for coming. We appreciate you.